We are here with Professor Jan-Yves Regenster from Belgium, President of European Society for Clinical and Economic Aspects of Osteoporosis and Osteoarthritis. Professor Regenster, can you tell us more about the report's scope and what scope means?
Scope stands for a scorecard for osteoporosis. It's to reflect on how osteoporosis is managed in the different countries in Europe.
What is your vision of osteoporosis in Europe?
Well, my vision today is that osteoporosis is a major disease that has a major burden in terms of mortality, in terms of morbidity, and in terms of economical cost, and that unfortunately osteoporosis is underrated, underscored, and undertreated today in Europe.
How do you foresee the diagnosis and treatment of osteoporosis engraving in Europe and in the not too far future?
Well, if we take a short future, which means 15 years from now, 10 years from now, let's take the horizon of 2025, we will probably be facing an increase of about 28 to 30% in the rate of fractures. So it's time now to understand that a lot of efforts have to be done in most European countries to increase the awareness of the patients, of the medical community, and of the political deciders on osteoporosis to realize that it's a dramatic disease that should be treated. If we do that, we have a fair chance that diagnosis and treatment of osteoporosis will be improved in the coming years.
What are big associations like ECCEO and IOF doing to improve the management of osteoporosis in Europe and in the world?
Well, at this stage, as I mentioned, we are trying to work at the level of the European Union politicians to make sure that they realize how important the burden of osteoporosis is. At the level of physicians, we try to increase their awareness by organizing courses on the diagnosis, on the screening, on treatment of osteoporosis. And obviously, together with the press, we need to have a contact with the lay population, with the general people, to let them know that osteoporosis is not a normal process of aging, but is really a disease that can impact their life.
And when will you come back to Italy with the International Osteoporosis Conference?
Why we come to this country? Because first of all, it's a country that everybody loves, and also because there is a strong local scientific society, the FIRMO, which is ruled by Professor Brandy from Florence, and we know that here the scientific level is very high and we can have a support to our efforts.
Thank you for the kind